Tonight, a major reversal by an influential physician advisory task force on who should take an aspirin a day to prevent heart attacks and strokes. CBS News chief medical correspondent Dr. Jon LaPook is here to explain. Good to have you, Dr. LaPook. So why was this change recommended?
For years, there's been a gradual evolution of guidance about who should be taking low-dose aspirin to prevent a first heart attack or stroke. We've seen a shift away from recommending it widely, Norah, because of the risks, especially bleeding into the gastrointestinal tract or into the brain. Now, there were two major recommendations today. First is that adults 60 and over should not start taking aspirin to prevent cardiovascular disease. For that group, the risks are felt to outweigh the potential benefits. The second recommendation, if you're 40 to 59 and have an estimated 10-year risk of 10% or greater 10-year risk of having a heart attack or stroke, starting low-dose aspirin at, say, 81 milligrams a day may provide a small benefit. Now, your healthcare provider can calculate that risk using an online calculator.
All right, so that's interesting. So who should keep taking their low-dose aspirin?
So important. People who have symptoms or evidence of cardiovascular disease, for example, somebody who's already had a heart attack or stroke, should keep taking their aspirin. And this new guidance is also not for people who need to take aspirin for some other condition, and it's also not for people who need to avoid aspirin because they have an increased risk of bleeding. And finally, if you're already taking aspirin and you don't fit into those categories, that's lots of people out there, check with your healthcare provider.
Check with your doctor. Dr. Jon LaPook, thank you so much.